Hi, everyone. We are going to talk about respiratory pathologies, but this is going to be a little bit different than the respiratory pathology lecture that is in your week 1 bonus resources. That one's 55 minutes long, and I go into a lot of detail about respiratory pathologies, what they could look like, what the symptoms are, what the treatments are, and massage implications. Today, I'm only going to focus on massage implications of respiratory pathologies. You can feel welcome to pause at any of these slides if you want to jot down some information. I will also include the slides for you in this assignment. However, please know if you want more details on the respiratory pathologies and their symptoms, please refer back to that 55-minute lecture that I do have in the bonus resources. That one was a little bit long to do an assignment on, so I left it in there for you if you wanted to do it or not based on your needs. All right. So we know the functions of the respiratory system already. Moving on, we know the parts of the respiratory system, the nose, nasal cavity. Remember for the MBLEX that the pharynx is your throat and the larynx is your voice box and your trachea is your windpipe. All right, the common cold. The thing to remember here when you're taking an intake, either verbal or written, if they talk about head cold, infectious rhinitis, or upper respiratory tract infection, they're probably talking about the common cold, and you are not going to touch them. This is a fever red stoplight, all right? No fever, no acute conditions, no viral conditions that are contagious. You will not massage someone, please, if they have a cold. All right. Sinusitis, we talked about. We also saw an awesome video in some of our assignments about how sinusitis works. This can be very uncomfortable for your clients. They could have facial swelling, teeth pain. They could have difficulty breathing through the nose. If they have an acute case of sinusitis, especially if it is a bacterial or viral infection causing this rather than allergies, they might have a fever. If they have a fever, they have to be fever-free for 24 hours. But here's the kicker. It needs to be without the use of fever-reducing drugs. All right. If they've been popping acetaminophen like candy that's artificially keeping that temperature low, that does not count as being fever-free. All right. So if they have a viral or bacterial infection, if they're contagious, if they have a fever with sinusitis, absolutely not. But if it's chronic or if it's fever-free, it's due to allergies, something like that, absolutely you can massage them. There are phenomenal massage techniques for the face that you can do. There is a video on one of those in your massage modality assignments assigned to you this week. Those are excellent to do. You want to elevate their upper body, though, while they are supine or sideline. We really want to limit the time that anybody with a respiratory pathology is in the prone position, all right? That's going to bring a lot of drainage forward in the sinuses. It's going to be very uncomfortable, especially around the ethmoid. All right, you can pause here, but remember there is a video about massage for facial pain and that nasal congestion. Our next one is pharyngitis. All right, remember our pharynx is our throat and pharyngitis is a sore throat or an inflamed throat. Remember, if you see itis on the MBLEX, we're thinking inflammation, infection, inflammation, inflammation. All right. Pharyngitis is sore throat. That could be drainage from allergies. It could be, a symptom of something worse like mononucleosis or influenza. You need to find out the cause before you massage them. Again, if they're infectious with a fever, no massage. 24 hours fever free. If they're non-infectious, absolutely you can massage them. But keep in mind when you communicate with them that to minimize speaking because they have a sore throat. They probably don't want to talk very much. Laryngitis is inflammation of the larynx, the voice box. All right. Again, ask about the cause. Were they yelling at their kids? Were they yelling at their neighbor? Were they yelling at the TV? Were they singing too loudly in the car and they've caused themselves to have a sore throat or a damaged voice box? Or do they have an infection? Do they have a fever? So it's the same thing with pharyngitis. If it's a non-infectious cause and they don't have a fever, go ahead and absolutely you can massage them. But just keep in mind that not only is it uncomfortable to talk, they may not be able to talk at all with laryngitis. Laryngeal cancer is a little bit different. Definitely not contagious, but you do need to talk to them about their current signs and symptoms. If you see this S/S, please know that that is a fantastic abbreviation for your SOAP notes, signs and symptoms, as well as side effects of their cancer treatments. All right. Are they cleared for any type of massage? You might want to find out from their PCP, which is primary care physician, or HCP, their healthcare physician. Make sure that they are cleared for massage. And again, elevate the upper body while supine and side lying and avoid or limit time in that prone position. Influenza, the flu. It can be comorbid with like things like COPD, and it's caused by multitudes of different viruses. Absolutely infectious, absolutely postpone, especially until they've been fever-free for 24 hours. Do not massage anyone with the flu unless you feel like getting it yourself. Infectious mononucleosis. If your client comes in trying to be cute and says, I caught the kissing disease, no. It's often caused by the Epstein-Barr virus. It absolutely can cause innocuous symptoms sometimes, like fatigue, as well as the sore throat. You can see how delightful that looks in the throat here. You are not going to massage them. This is very contagious because even though they may call it the kissing disease, you can get it through droplets. If they cough on their hand instead of their forearm, and then they grab the doorknob in your massage office, then you grab the doorknob in your massage office, then you scratch your mouth absent-mindedly. Before you wash your hands, guess what? You also now have infectious mononucleosis. So please avoid patients with this, clients with the cold, influenza, and mononucleosis. Now we're going to talk about lower respiratory tract infections. Pneumonia is a big one. This is an infection or inflammation of the lungs. Usually, someone will get something else first, like the common cold or influenza. It can be pretty intense. All right. We are not going to massage people with pneumonia. It is contraindicated until that client has recovered completely. All right. Once they are cleared for massage, if they still have mucus or any type of fluid buildup, you can use postural drainage. All right. Remember that position where they're leaning forward, not the tripod position necessarily that helps them breathe easier, but leaning forward. Percussion, remember we do cupping, not slapping. We do the cupping or some tapping and beating. If again, the healthcare provider recommends it to help them with a productive cough. Now, remember, a productive cough is a cough that they are coughing up phlegm or that fluid, something productively coming out. And this is my reminder to you again, have tissues, have things for them to cough into, have hand sanitizer, have a plastic liner that you can close and tie off inside of your trash cans, have trash cans that you can clean with bleach. Make sure that you are set up and ready for a client that will probably have a sneeze, a productive cough, something going on where they potentially have biohazardous waste, body fluids coming out and into your massage room trash can, not just the bathroom. Postural drainage and percussion. You can pause here and take a peek at this, but please remember there are some awesome videos about this in your massage modality respiratory assignments this week. All right, tuberculosis, white plague, or consumption. All right, the latent stage is pretty scary because your clients can be asymptomatic, meaning we have no symptoms. A means without. Symptomatic, we're talking about the symptoms. You don't know that they have TB. Some clients will go in and get a TB test, especially if they're going to go work in the healthcare field. They're required to have those before working with the public. So if they have a TB test that has been done, you're going to avoid the site. You're going to treat that as a local contraindication. This is just a test to see if they have TB. If they have latent TB, if you find out because they've had a chest x-ray or they've been tested, you need to postpone the massage until they are no longer infectious. If they have active TB, tuberculosis, it is absolutely postponed until it is no longer active, and that needs to be determined by the healthcare provider, right? The HCP. Clients who have been cleared and are able to receive massage, again, same position for every respiratory pathology. Elevate the upper body while supine and side lying if it's more comfortable for the client to breathe that way, and avoid and limit the time in prone position. Pleurisy. Wet pleurisy or pleural effusion is when we have fluid in the pleural space. Now, remember, you've got the visceral and parietal pleura that is in there surrounding the lungs, and you've got some fluid in there allowing those tissue surfaces to rub against each other without friction. Dry pleurisy is a reduction of those intrapleural fluids, and that is going to be painful because then they are getting that friction as those tissues slide against each other. You do not massage people with pleurisy, especially if they have wet pleurisy, because there are some incidences of that fluid building up in the cardiac space as well. Lung cancer, this is like all other cancers for the most part. You're going to find out about current signs and symptoms as well as the side effects of those cancer treatments. If they are cleared for it, you're going to pay attention to how they feel, make adjustments for any type of frailty or fragility that they might have, and avoid or limit time in the prone position. All right, now we're going to talk about COPDs, chronic obstructive pulmonary diseases. The tripod position we talked about briefly, it is in your other assignments. This is the position that will help your clients breathe. If you are doing your intake and you see them doing this a lot, that is a good indicator that they have disordered breathing or dysfunctional breathing of some type. So please be aware of this. Another thing you may notice during your intake while you're talking to your client or doing the hand massage is nail clubbing. All right, this is the enlargement of fingertips and the downward curvature of the fingernails. And the fingertips might also be cyanotic. Remember, cyanosis is the term for your MBLEX. That means that your skin is turning blue, usually from lack of oxygen. So please be aware if you see this on their fingernails. You can also see it on toenails as well, but it's more often in the fingers, that this is a sign of breathing issues. All right. There's also a term called pink puffers for people with advanced emphysema, and blue bloaters, people with chronic bronchitis. All right. Blue is from the cyanosis due to low levels of oxygen, but they also may be getting bloating from heart failure related issues. So this is something to look out for in your client's disposition when they come in. If they're coughing, if they're overweight and they have a blue tinge to the skin, they could be having some type of edema. You might hear them rattling when they're breathing or wheezing. The pink puffers, they have very labored breathing. They're usually older. This is our geriatric set, and they're very thin. Sometimes they'll have a barrel chest, which we'll talk about in just a moment. They will exhibit shortness of breath, and they'll use the accessory muscles to breathe because those intercostals are either ineffective at this point or they're very worn out, and they have frequent respiratory infections. All right, asthma. Ask about allergens. Ask about allergens. Eliminate them from your office, whether that's aromatherapy things, oil diffusers. Do you have a lot of dust built up on your heating or air conditioning vents, on your ceiling fans, on your windowsills? Are you vacuuming enough? Are you getting the dust out of the air? Do you have things that smell strongly? Even things like bleach, if you're overusing the bleach, although that normally will cause dermatitis, some people can have an asthma attack. It feels like it's burning their throat and their lungs at the same time. If they have long-term use of inhaled corticosteroids, you need to reduce pressure over the areas of known bone loss if they've been using those steroids for a long time, and use very gentle PROM. Remember that abbreviation for the MBLEX. PROM is passive range of motion. Okay. If they have an inhaler, keep it in an accessible spot. Don't let them leave it in their purse. Don't let them leave it in a pocket. Put it on a small side table by the bed or somewhere on the counter in the room or a chair next to the table so that either you or the client can grab it very quickly for them if they start to have a breathing issue and need it. You need to avoid aromatherapy and essential oils for the most spot. You can potentially use inhaled lavender, peppermint, eucalyptus, depending. Those are known as bronchodilators and can be relaxing or uplifting depending on what you're using. But you need to be careful with what your client is allergic to and can handle. This is the same position for all respiratory pathologies. Say it with me. Elevate the upper body while supine and side lying, and avoid or limit time in the prone position. All right. You can also consider passively stretching the thoracic structures using a rolled up towel and sort of pulling and lifting them up to stretch them out. You can also recommend stretching and controlled breathing techniques at home. There are a lot of videos about various breathing techniques, including a really cool one for diaphragmatic breathing from the University of Michigan in your massage modality respiratory assignments this week. I'm skipping through these because they are in your other assignment, but feel free to pause and look at them if you want to see them again in this video. All right, bronchitis. People might call it a chest cold when it's acute. If it's chronic, it could be allergies, but it's probably from something like cigarette smoking or inhaling toxins from a work site or other polluted environment that they might be in for a long period of time. If it's an acute case, we hear itis, and it's probably a bad thing, okay? If it's acute, massage is postponed until the client is fever-free for 24 hours. If it's chronic and they use an inhaler, keep that inhaler available in a very accessible spot. Same position, elevate the upper body while supine and side lying, avoid or limit time in prone position. This is a case with both asthma and bronchitis can produce a lot of mucus. So postural drainage and percussion can be absolutely awesome if it's recommended by the primary care physician or the HCP. And again, you can use the thoracic stretch or controlled breathing techniques that we talked about earlier. Emphysema is a pretty intense form of COPD that causes permanent enlargement of the lower airways. So the enlarged alveoli don't efficiently remove the trapped air. So what happens? Your clients will get this barrel chest over time. It occurs because the lungs are chronically overinflated and the rib cage stays partially expanded. All right, just imagine what that does to the intercostal muscles as well as the accessory muscles for breathing. If they have an inhaler, again, or oxygen, which stays on, put it in an accessible area. Again, elevate them when they're supine and side lying. Postural drainage and percussion can be done. They might need you to be a little bit more gentle, especially when they have an advanced barrel chest. So make sure that you are really paying attention to this. You might need to massage more slowly and use lighter pressure, especially those with advanced stages of emphysema. All right, pneumoconiosis. This is usually caused by long-term occupational exposure to things like dust, asbestos, silica, coal dust. These particles will deposit in the lungs over time, and that causes chronic inflammation and scarring. They're probably going to have an inhaler or they're going to have difficulty breathing. Definitely pay attention to body posture, elevating the upper body while supine and side lying, and also avoid and limit time in the prone position. Postural drainage, it might be more effective in this position. I would be careful with percussion depending on how sore they are. Definitely you can teach them the controlled breathing, but depending on how bad they are with this and for emphysema, you may cause a coughing fit. So don't be startled if they already have that difficulty breathing. Really getting them to open up and try to take that air in might cause spontaneous coughing. With them as well, because they could be in a lot of visceral pain in this condition, you might need to massage more slowly using lighter pressure. Cystic fibrosis. The thing to remember about cystic fibrosis for your MBLEX is that it is a genetic disorder characterized by abnormal mucus production. Lots of mucus, but it's not thin, slippery mucus that slides out really easily. It is thick and sticky. It clogs the passageways, all right, especially the respiratory and digestive tracts. If they have an inhaler, keep it nearby. Keep them in that respiratory position. Use postural drainage and percussion. They might want a lot of percussion. They may need deeper percussion, but they also may be sensitive. So please make sure that they are not frail or fragile. You're doing palliative care. You're massaging more slowly and using lighter pressure if you need to. For this particular condition. And again, remember for the MBLEX, cystic fibrosis is a genetic condition. Obstructive sleep apnea. This is a sleep disorder characterized by temporary absence of normal breathing caused by a blocked upper airway. And as those CO2 levels build up from improper breathing, the client's going to wake up when they fall asleep. When they're laying supine, especially on your table, the throat and tongue relax as they start sleeping and it blocks the airway and they're unable to breathe. All right. You need to elevate the upper body while supine and side lying. It says to avoid and limit time in the prone position, but honestly, if they have obstructive sleep apnea, the prone position very often opens them up and they are able to breathe a little bit better. And I would not lay them flat on their back. The one thing I would absolutely say is if your client starts to fall asleep, gently wake them up because they could startle themselves awake by snorting and gasping as they wake up. As soon as they fall asleep, which could startle you, it could startle them and completely disrupt the massage flow. So if your client has sleep apnea or sleep disorders, kind of make sure that they stay awake during the massage. All right, the next thing we have is vascular disorders. We're going to talk about pulmonary edema first. This is excess fluid in the lungs. If it's acute, it appears suddenly. If it's chronic, it develops over time. This can also happen to people that are traveling to or exercising at high altitudes for a long period of time. This is absolutely postponed until the condition resolves. A pulmonary embolism is an occluded or blocked pulmonary artery, and 90% of emboli originate as clots from deep leg veins, all right? These are deep vein thromboses or thrombosis that causes this, DVTs. It's more common in your pregnant ladies. If they have a pulmonary embolism, massage is postponed until it is resolved. We do not want to dislodge that and cause a major issue. So an immune disorder that we'd like to talk about is hay fever. This is a hypersensitivity of nasal mucosa to allergens, usually plant pollens. It's also called allergic rhinitis, all right? Now, this could happen seasonally if it's just an allergy like to tree pollen, grass pollen, weed pollen. But if you have someone that has it chronically due to dust mites, pet dander, molds, any type of fungus, you need to be aware of this. You may have cases where a client is so susceptible to this that you may need to have a clean uniform to wear in your office for clients with allergens. And if you have pets at home, change out of the clothing that you use to drive to your office or get to your office, and then change into your clean work uniform to work on your clients so you're not accidentally transferring any animal hair that has the dander on it. Or any type of pet dander, and you need to make sure that you are on top of the dust in your office. Ask about those allergens, make sure that you handle them in your office, avoid contact if possible. If this is extremely bad, they will have a prescribed EpiPen. just like the inhaler, make sure that that's an accessible area so you can get it quick to help them out if they're going into anaphylactic shock or having some other major allergic reaction. You can absolutely use facial massage to help relieve those areas. And these are the same ones that we would use in sinusitis. All right, if someone is choking, this is a blocked trachea preventing them from breathing. Confirm they're choking. If they can talk, like if it's your kid yelling, I can't breathe, I'm choking, they're not choking. Encourage them to cough. If there's airflow coming in and out so that they can yell or talk, they're not quite choking yet. If they are choking and they cannot cough or speak, they have difficulty breathing, they're turning blue, the suggestion here is to use the Heimlich maneuver, which is the abdominal thrust. However, Miss Ellis highly recommends a little device called the dechoker. I wish I had one right here to tell you about, but they're super cool. You just put it over someone's face, and then a little tube goes right inside of their mouth, and it has a big plunger on it that you can pull. I don't know if you can see me in the video here. I look ridiculous, like I'm pulling an elephant trunk, but it will suction out, and it usually dislodges whatever is in there. I actually have one by my dining room. I have one by my massage office. And since I have kids that love to say that they're starving to death in the car, and I don't want to have a situation of someone choking on the road and not being able to handle it or get emergency care to us quickly, I actually carry one in the car for car trips as well. If you don't have one of those devices, which I highly recommend you order one, you definitely can do the Heimlich maneuver. That's wrapping your arms around the victim's waist, making a fist with your hand, and placing the thumb side against their upper abdomen. You want to be below the xiphoid process. That's that pointy bit, all right, underneath the body of the sternum. You don't want to break that off. You're going to do abdominal thrusts to try to dislodge that object. Now, if you cannot reach around the victim, and this is another reason I have a dechoker, I am 5'4", I have tiny little T-Rex arms. I cannot reach around some of my clients that are on my table. And if a client is pregnant, you don't want to be doing those thrusts there. Potentially cause a miscarriage, damage to the baby. Like, that's an absolute no-no. So they say here to compress the sternum between the victim's breasts. That's nowhere near as effective. So again, just for these two reasons right here, I get no compensation from Dechoker. They don't know I exist, although they are an excellent company. One of mine cracked and they sent me a free one as a replacement, by the way. Super cool company, super cool device. I recommend it or something similar just to save you in this type of situation, especially if you've got things like peppermints in your office that your clients could suck on and then get nervous when you walk in the room, or chewing gum and they swallow it because they forgot to spit it in the trash can when they lay down. Anything could happen, so please try to be prepared. And of course, always, if they're unresponsive, call 911 here in Michigan and continue helping them if they're unresponsive, doing CPR until EMTs arrive. All right, that's all I've got for you today on this lecture, and I will see you guys on the next one.